Hello everyone. Today I came with such new topic that is peptic ulcer disease. So today I'll be discussing about what is the definition, epidemiology, types, then classifications among the based on its modified Johnson classification, based on its locations and based on its severity. So let's see what is exactly this peptic ulcer disease. So as you can see, this is an open sore that occurs in the lining of the stomach. So think that is our stomach. So in our stomach, that is esophagus. So that connect with our mouth to the stomach main part. Through that, food passes to the stomach area. That is called esophagus. And this is the main body that is fundus. And as you can see, this is greater curvature and this is pyloric antrum. So suppose due to imbalance of any protective factors in our stomachs like bicarbonate, then HCl, pepsins, which helps in digestion of our food, due to imbalance or due to any kind of bacteria, that specific H. pylori, which we will be discussing in the etiology. So due to that, some reasons that will start to damaging the layer or mucus of the stomach area, this area, and that directly leads a painful sore that called is ulcer. So let's see the definitions. That's an open sore that occurs in the lining of the stomach or duodenum. So this is the duodenal ulcers if it happens in the duodenal area. If it happens in the stomach area, main body part, that will lead to gastric ulcer. And if it happens in the esophagus, that will lead to esophageal ulcer. So peptic means pepsins, which helps to digest, and due to imbalance of these factors and due to other etiological factor, that will lead sores. That's called ulcer. That will be very very painful. Let's say epidemiology. So in epidemiology, we'll be discussing about like how much percentage of the people of the world they're suffering with this peptic ulcer disease. So global problem with lifetime risk is around 5 to 10%. And another more important information that I like to say that is duodenal ulcers are more common in men and than women. And approx 10% American developed the chronic peptic ulcer disease. So here the duodenal ulcers are 4 times. This is 4 times they have a higher chance to causing the duodenal ulcer than gastric ulcer due to some reasons which I'll be telling you later. The mortality high. That mortality rate is mostly the persons whose age is 65 or older than 65 years. And they have made a rank due to that peptic ulcer disease among the people that they got is fifth largest, like India ranked fifth in the world of this having peptic ulcer disease. So we already saw the definitions in epidemiology. Let's see the types. So as per locations of the stomach, they have divided into three main part, and another I have added that is Meckel's diverticulum ulcers. So stomach or gastric ulcer, if it happens in the gastrointestinal area, the main part of the stomach, that called stomach or gastric ulcer. Then second part, if it happens in the duodenal area, that connects the small intestine and large intestine, that last part of the stomach. If it happens, then it's called duodenal ulcers. And if it happens in the front part of the mouth to stomach area, that connected area, esophagus area, that will lead to esophageal ulcer. And Meckel's diverticulum ulcer is basically a congenital ulcer that mainly sins in baby. So due to their abnormal functions and physiological abnormality, they have the diverticulum in the large and small intestine area. That part will be very very sore or painful due to the baby's abnormalities, their protective functions. That will lead to Meckel's diverticulum ulcer. The main thing is that the stomach ulcer, duodenal ulcer, and esophageal ulcer. And another that is very important classification, that is modified Johnson classification. So they have total 5 classification. First one is ulcers along the laser curvature. So as I can tell you, this is greater curvature and this is lesser curvature. Okay, this is. So if ulcer happens in this area, this is type 1. Type 2 would be comes under that the same types, that is gastric and duodenal ulcer. Type 3 would be H. pylori. So this is a bacteria, Helicobacter pylori bacteria. So if that bacteria will leads ulcer, then it's called H. pylori induced ulcer. Type 4 would be proximal gastroesophageal ulcer. That also comes in the proximal area. And type 5, which mostly many patients they have, that is NSAID, non-steroidal anti-inflammatory drug induced ulcer. Like if you are taking simple paracetamol, this paracetamol if you are taking for a prolonged time or for a lifetime period, due to taking its containing pharmaceutical ingredient that will directly leads your GI bleeding and even ulcer. So that's called NSAID induced ulcer. So
So
this.
let's see the etiology and risk factors for peptic ulcer disease. So there would be very different risk factors and reasons that will directly lead to ulcers in our body. First is lifestyle. So we should focus on the lifestyle either that will leads that very dangerous disease in our body. First is smoking. So smoking can directly cause peptic ulcer disease. Then acidic drink, medications such as NSAIDs that will lead to that peptic ulcer disease like gastric ulcer and duodenal ulcer, alcohol, and stress, because due to this lifestyle disbalance that will have directly effect on our stomachs, and that will make disbalance some gastric juices, and that directly leads to cause this peptic ulcer disease in the body. So let's say the age. So duodenal ulcers, mostly the patients whose age is 30 to 40 years, and gastric ulcer over 50 years patient they have that. Genetic factors. So there is no such research says that specific genetic persons they will have they are more prone to get that peptic ulcer disease. No, but research says that the persons whose blood group is O because they have more amount of H antigen present in their blood group, and this H antigens will directly call this H pylori bacteria for colonizations. So they are more prone or they are more risk to get that diseases. Second one is Zollinger-Ellison syndrome. So this syndrome is basically says that this is a genetic disorder, is a rare disorder in which tumors secrete large amount of the hormone gastrin. That conditions with gastric secreting tumor of hyperplasia of at islet cells in pancreas where that will increase the gastric acid secretions, and that will attacks the lining of the stomach. So specifically this Zollinger-Ellison syndrome that says that means excessive acid productions. Another some reasons that also can lead this peptic ulcer disease like virus, cytomegalovirus, and radiation chemotherapy also can play a major role to cause this disease. Then dietary factors. So carbonated beverage, coffee, tea, beer, milk, spices often cause dyspepsia, but they do not appear to increase the risk of peptic ulcer disease. In somehow amount of caffeine, that is a gastric acid stimulant, so that may lead this syndrome. Then let's see the main culprit of causing this peptic ulcer disease is H. pylori. So H. pylori, it is a Helicobacter pylori. It is a bacteria. It's a spiral, microphilic, and gram-negative bacteria with flagella that has urease, catalase, and oxidative activity. So that will release some enzyme that is have a role in causing this urease, catalase, and oxidative pathway. So these factors allows the bacterium to survive in the acidic environment of the stomach. How does it transmit to our body? Primarily transmitted via person to person by either gastro-oral like vomiters or fecal-oral like diarrhea contact. So 90 to 95% duodenal ulcers are caused by this Helicobacter pylori, and this gastric ulcer is basically 80 to 85% caused by this H. pylori. So let's talk about the things that may complicate it for this disease or for the person, that is GI bleeding. Then perforations. That means in holes in the cells or the mucus layer of the stomach. Now obstruction. So gastric dilate like by scarring muscular spasm or edema. Then penetration ulcer may penetrate into an adjacent structure, pancreas, livers or biliary tract. And last but not the least, that is cancer. So this cancer or malignant uh, tumor that will directly have an effect on this peptic ulcer disease. So these are the some complications. Now let's talk about the pathophysiology. So there we'll be focusing on the main two things. One is H. pylori induced, helicobacter pylori induced, and NSAID induced, that is non-steroidal anti-inflammatory drug induced ulcer.